Gather equipments such as gloves, sterile gloves, MSS basin, gauze pads, alcohol, and also the water that will be used. Then check medication order against the original physician's order according to agency policy, and then clarify any inconsistencies. Check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of the medication for the patient. Then perform hand hygiene. Prepare medications for one patient at a time. Read the MAR and select the proper medication from patient's medication drawer or unit stock. Compare the label with the MAR medication administration record, check expiration dates, and perform calculations if necessary. When all medications for one have been prepared, recheck the label with the MAR before taking them to the patient, and return the medication stock to the patient's drawer. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient. Usually, the patient should be identified using two methods. Compare information with the mark, check the name or the name band. If the patient cannot identify him or herself, verify the patient's identification to the significant others. Complete necessary assessments before administering the medications. Check allergy bracelet or ask patient about allergies, and then explain the purpose of the action of each of the medication. And then perform hand hygiene, and then put on gloves. Use non-sterile gloves unless the skin is broken, and then apply sterile gloves. And then wash, rinse, and dry the affected area with water and clean gauze. If his skin is very dry and flaking, apply topical medication while skin is still damp. and then place required amount of medication using a cotton tip applicator. Note, the cotton tip applicator is sterile and is for single use. Let the patient know that initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. Then observe signs of irritation or redness. Remove gloves and then perform hand hygiene. Document the procedure in the patient's chart.